Welcome back to the course on nutrition and planetary health, presented by the Physicians Association for Nutrition and PANCO. This course provides an evidence-based foundation for how dietary patterns influence both human health and planetary health, and how this knowledge can be applied in clinical practice to promote healthy and sustainable diets. Let's continue with the last module on putting healthy and sustainable diets into practice. Let's get started with the final lesson: how to build a healthy and sustainable meal. We will discuss translating nutrition evidence into simple, everyday meal structures for clinicians and patients. Before you begin this lesson, please answer the following question. This ungraded question is designed to get you thinking. If you are unsure, take your best guess. Which of the following plate compositions is most consistent with evidence on healthy and sustainable diets? A. Half animal protein, quarter vegetables, quarter refined grains. B. Half vegetables and fruits, quarter whole grains, quarter protein foods with emphasis on plant sources. C. Half refined carbohydrates, quarter vegetables, quarter protein. D. Equal portions of meat, dairy, and grains. The correct answer is B. Half vegetables and fruits, quarter whole grains, quarter protein foods with emphasis on plant sources. A large body of evidence, discussed in previous lessons, consistently shows that dietary patterns rich in plant foods, whole grains, and diverse protein sources are associated with lower risks of chronic disease and lower environmental impacts compared with diets high in red and processed meat and refined foods. Rockstrom et al., 2025. Willett et al., 2019. This final lesson concludes this course by focusing on how evidence on healthy and sustainable diets can be translated into simple meal structures that clinicians and patients can use in everyday life. Most dietary guidelines describe patterns over weeks or months, not individual meals. However, patients often ask a simpler question: what should my plate look like? Practical meal structures can help turn complex nutrition science into everyday choices. Several frameworks converge on a similar principle: plant-rich plates with balanced macronutrients and minimally processed foods. Examples include the Harvard Healthy Eating Plate, the Planetary Health Diet Reference Plate, the Mediterranean Diet Meal Structure, and National Dietary Guideline Plate models. Despite different origins, these models generally emphasize large proportions of vegetables and fruits, whole grains as staple carbohydrate sources, diverse protein sources with emphasis on plant proteins, and limited ultra-processed foods and processed meats. One of the simplest tools for clinicians is the balanced plate model, which visually divides a meal into proportions. A common evidence-based structure could include the following components. Half the plate should include vegetables and fruits. These provide fiber, micronutrients, and phytochemicals associated with cardiometabolic health. Higher fruit and vegetable intake is consistently associated with lower risk of non-communicable diseases and mortality. 1/4 of the plate could be whole grains or minimally processed starches. For example, brown rice, whole wheat, oats, quinoa, millet, and sweet potatoes. These whole grains are associated with a lower risk of cardiovascular disease and type 2 diabetes compared with refined grains. 1/4 of the plate should be protein foods. Healthy protein sources can include legumes and pulses, nuts and seeds, with an emphasis on plant sources. Plant protein sources generally have lower environmental impacts and are associated with favorable cardiometabolic outcomes. Meal frameworks can be adapted across different cultural food contexts. 3 commonly used formats are plates, bowls, and thalis. Bowl-based meals are increasingly common globally and can easily incorporate healthy components. An example bowl could include a base of whole grains or legumes, with roasted or fresh vegetables, beans or tofu as protein, and nuts, seeds, avocado, and olive oil as healthy fats. Bowl meals can support dietary diversity and make portion balance visually clear. In South Asian contexts, the thali provides a useful, culturally relevant framework. A balanced thali may include roti, brown rice, or millet as a whole grain staple, dal as lentil or a soy-based dish, with 1 or 2 vegetable preparations. Traditional dietary patterns built around diverse plant foods often align well with evidence-based nutrition guidance. Healthy diets are not only about proportions, but also about dietary diversity. Consuming a variety of plant foods helps ensure adequate intake of fiber, vitamins, minerals, and phytochemicals. Dietary diversity is associated with improved micronutrient adequacy and overall diet quality. Encouraging patients to vary their vegetable, grain, and protein sources throughout the week can improve diet quality, nutritional adequacy, and health outcomes. Clinicians often have limited consultation time. Simple frameworks can help translate dietary guidance into actionable advice. Using the half-plate vegetables rule, encourage patients to fill half their plate with vegetables at main meals. Swap refined grains for whole grains through small substitutions, such as replacing white rice with brown rice or refined bread with whole grain bread, can improve dietary quality. Shift protein balance by encouraging more legumes, beans, and nuts, and by limiting red and processed meat intake. Focus on addition rather than restriction. Adding protective foods can be more effective behaviorally than focusing solely on foods to avoid. These approaches align with behavioral counseling strategies discussed in the previous lesson. Before we wrap up this lesson, let's look at the key takeaways to recap what we learned. First, healthy and sustainable diets can be translated into simple meal structures that are easier for patients to follow. Second, a balanced meal typically includes vegetables and fruits, whole grains, and diverse protein sources. Third, visual frameworks such as plate models, bowl meals, and thalis structures help translate nutrition evidence into everyday eating patterns. Fourth, increasing dietary diversity and the proportion of plant foods supports both human and planetary health. Fifth, simple, practical guidance can help clinicians integrate nutrition discussions into routine care. Now, before you finish this final lesson, let's assess your learning through a quick question. Based on what you learned in this lesson, answer the following question. Which of the following meal compositions best reflects evidence-based guidance for healthy and sustainable diets? A. Half refined carbohydrates, half animal protein. B. Equal portions of meat, dairy, and grains. C. Half vegetables and fruits, quarter whole grains, quarter protein foods. D. Mostly processed foods with added supplements. The correct answer is C. Half vegetables and fruits, quarter whole grains, quarter protein foods. This reflects the central message of the lesson. Balanced meals built around vegetables and fruits, whole grains, and diverse protein sources are most consistent with the evidence on healthy and sustainable diets. This final lesson has focused on translating evidence into everyday meals. Throughout the course, we have examined the role of diet in shaping health outcomes, the characteristics of healthy and sustainable dietary patterns, and practical strategies to support dietary change. For clinicians, the next step is implementation. Simple, consistent guidance on building balanced meals and shifting toward more plant-rich diets can help patients make meaningful changes over time. These changes, when scaled across populations, have the potential to improve both human and planetary health. We would value your feedback. Please scan the QR code on screen to share your thoughts on the course content and help us improve this learning resource. Thank you for completing this course on nutrition and planetary health. This course was developed and presented by the Physicians Association for Nutrition and Panko.